Hi, my name's Sydney Wadden, and I'm a BSN student at Georgian College. I'll be completing this presentation on blood transfusions and cerebrovascular accidents. A cerebrovascular accident is the death of brain cells caused by ischemia or hemorrhage in part of the brain. CVAs are most commonly known as a stroke. Strokes are the third most common cause of death in Canada, and approximately 16,000 Canadians die of strokes each year. It's important for nurses to be able to identify the signs and symptoms of a stroke to ensure timely treatment is started. The Heart and Stroke Foundation has come up with the acronym FAST to identify a stroke. FAST stands for face, arms, speech, and time. Is the face drooping? Can you raise both arms? Is the speech slurred or jumbled? If so, call emergency services as soon as possible. Some key signs that nurses can identify on inspection include facial paralysis, often affecting one side of the face. The patient may also have weakness or paralysis on one side of the body, which can cause unequal grip strength and altered gait and balance. The patient's speech may be slurred, jumbled, or incoherent. The nurse may also find that the pupils are unequal in size and reactivity. The patient may have decreased level of consciousness and be drowsy and difficult to wake. The patient's vital signs would also reflect an increase in blood pressure and decreased oxygenation. Here are some key questions that the nurse can ask that would elicit signs and symptoms of a stroke. Are you having any vision changes, such as blurred or double vision? Have you had a sudden severe headache? Have you had any recent head injuries? Are you experiencing any numbness? Do you have any changes in balance? Do you have any problems swallowing? Have you had any difficulty speaking or any issues with forming words or saying what you intended to say? The nurse should then continue the assessment with auscultation. The nurse may find a carotid bruit which may be caused by plaque buildup and can increase the risk of a stroke. The patient may also have an increased heart rate, and changes with breathing such as tachypnea, labored or irregular respirations, and wheezing on aspiration may occur. The remaining two areas of a nursing assessment are palpation and percussion. These two assessments would not normally be used to identify a stroke, but may be used after a patient has suffered a stroke to identify any complications. For example, after a stroke, patients may suffer from several complications, including constipation and urinary retention. A distended, firm, and tender abdomen may be found during abdominal palpation and percussion if constipation or urinary retention occurs. These are important to identify quickly to prevent further negative outcomes. Now let's introduce blood transfusions. Blood transfusions are the intravenous administration of blood or blood components. The purpose of blood transfusions is to increase blood volume, increase the number of red blood cells and maintain hemoglobin levels, as well as provide cellular components as replacement therapy. Blood transfusions may be given to prevent a stroke, such as in patients with anemia or sickle cell disease. If a stroke has already occurred, a blood transfusion may be given to reduce or control bleeding and prevent further damage. The ABO blood typing system identifies blood types as O, A, B, or AB. The blood types are based on the presence or absence of antigens. As you can see in this chart, the A blood type contains A antigens, B blood type contains B antigens, AB blood type has both A and B antigens, and the O blood type doesn't have any antigens. Antigens are like name tags that identify the red blood cells as self cells. The blood also contains plasma antibodies. These antibodies are present for the antigens that are not in the blood. Again, looking at the chart, you can see that the A blood type contains anti-B antibodies, B blood type contains anti-A antibodies, O blood type has both anti-A and anti-B antibodies since it doesn't have either antigens, and then AB blood type doesn't contain any antibodies since it has both antigens. The antibodies are responsible for attacking the non-self antigens. This is why it's important not to give blood products to a patient with the wrong blood type. In addition to the ABO blood type, there is also the Rh factor that needs to be considered. The presence or absence of the Rh factor in the red blood cells determines the positive or negative blood type. Rh positive individuals have the Rh factor and have a positive blood type. Rh negative individuals do not have the Rh factor and have a negative blood type. As you can see from this chart, individuals with Rh positive blood can receive blood from both Rh positive and Rh negative donors, but Rh negative individuals can only receive Rh negative blood. You can see in this chart that AB positive blood is the universal recipient and can receive any blood type, and O negative blood is a universal donor and can donate to anyone. It is vital to determine the patient's blood type prior to administering any blood products to avoid a negative blood transfusion reaction. If the wrong blood product is given, a reaction is caused by the ABO incompatibility since the antibodies in the patient's blood attach to the blood product cells. This causes the blood cells to clump together and agglutinate in the capillaries. This blocks blood flow, leading to ischemia and cellular death. This type of reaction can lead to a stroke if a blood clot makes its way to the brain. This can be an extremely life-threatening reaction that needs to be avoided at all costs. The blood bank is responsible for typing and cross-matching the patient's blood. Along with the matching of the patient's ABO blood type, the blood bank will also cross-match the blood by mixing small amounts of the patient's blood and the donor's blood to determine if agglutination occurs. If not, the blood is properly crossed and matched. Once the blood is ready to administer to the patient, as I will discuss in the next few slides, there must be an independent double check by 2 registered healthcare workers to ensure that the correct blood product is being given to the correct patient. The following equipment and solutions are required for blood transfusions. First is an infusion pump. This pump must be appropriate for blood transfusions according to the hospital policy. You'll also need an IV site prepared with an 18 to 22 gauge catheter as well as saline solution. The blood administration tubing must be prepared with a 70 to 260 micron filter. The most commonly used tubing is the Y-type tubing that allows the administration of isotonic saline with the blood product. And then of course you need the blood product as ordered by the physician. These include whole blood, platelets, plasma, packed red blood cells, cryoprecipitate, or albumin. The blood transfusion does need to begin within 30 minutes of picking up the blood product from the blood bank, so it's important to be fully set up with all the equipment and solutions prior to picking up the blood products. Now I'll discuss the rate of infusion and monitoring a patient receiving a blood transfusion. First, pre-administration vital signs should be collected for a baseline measure. The initial rate of the infusion should be no more than 2 milliliters per minute for the first 15 minutes. The nurse should be prepared to remain with the patient for the first 15 minutes or 50 milliliters of blood infusion to assess for signs and symptoms of a reaction. If there's no reaction occurring, the blood transfusion can be increased to the rate ordered by the physician. The vital signs should then be monitored every 30 minutes throughout the transfusion. The patient should continue to be monitored for up to 1 hour after the transfusion is complete. The tubing should be changed after every 2 units of blood to prevent the clogging of the microfilter. The unit should be infused within a 4-hour period to prevent bacterial accumulation. Blood transfusion reactions can range from mild to life-threatening. The reaction can be acute or delayed. The most common reaction is a febrile non-hemolytic reaction, which occurs most often in patients receiving 5 or more blood transfusions in their lifetime. This occurs because antibodies are developed to the small amount of white blood cells in the blood product. When the blood transfusion occurs, the antibodies attack the white blood cells in the donor blood. This type of acute reaction may be avoided by using additional filters in the transfusion tubing or removing the white blood cells from the blood products prior to storage. If the patient has received previous blood transfusions, the physician may prescribe prophylactic acetaminophen or diphenhydramine to lessen the fever symptoms and immune response. Symptoms of febrile non-hemolytic reaction include fever, chills, shaking, nausea, possibly vomiting, and muscle aches. It is important to be able to identify and intervene with any acute transfusion reactions. If a transfusion reaction is suspected, stop the transfusion immediately. Then maintain a patent IV line by running a saline solution. Notify the blood bank and the physician immediately. Then recheck the ID tags and numbers on all the blood bank products to ensure that the correct product was given to the correct patient. Then monitor the patient's vital signs and urine output closely. It's important to treat the symptoms as per the physician's orders, and then save and return the blood bag and tubing to the blood bank. Collect blood and urine samples at intervals set by the healthcare facility to evaluate for hemolysis, and then document all of the interventions, and treatment provided for the patient. Strokes and blood transfusion reactions are potentially life-threatening conditions that should be quickly identified and treated. Here are the references I used throughout this presentation. Thank you for listening.